Samuel, who has become a household name in St. Kitts and Nevis for his capable management of the COVID-19 pandemic. Of course, he is chair of the COVID-19 National Task Force, and he's also the National Disaster Coordinator at the National Emergency Management Agency, what we refer to as NEMA. So he comes quite equipped to talk about hurricanes, but at the very same time, under the peculiar circumstances in which we find ourselves with the management of the COVID-19 pandemic. Mr. Samuel, welcome.
And thank you, Mr. Williams. You are such a familiar face to me, yes? It's nice being here. It's a pleasure for us to start this program, which I think is very informative, and it's timely for us to engage the general public more on what the government in general is doing as it regards to good governance, governing the country, and also preparedness for many impacts that we face due to our geographical location in the Caribbean region. So therefore, the hurricane season is upon us. We have been stressing hurricane preparedness in our National Emergency Operations Center briefing. And we look forward to having a good discussion this afternoon and placing the country in a position where they understand where we are in terms of preparedness, the roles and responsibilities of the government, and also the responsibility that you as a citizen have in terms of preparing yourself. So let's get going, that's why, so we could have a good discussion.
Mr. Samuel, of course, you spoke about the geographic location, where we are located in the world. And every year, of course, we have the Atlantic hurricane season, which runs from June 1st to November 30th. And of course, because we live in that geographical location in this part of the world, we have to develop geographic awareness. I want you to tell me, Mr. Samuel, what is the forecast for the 2020 Atlantic hurricane season?
And yes, Mr. Williams, the National Hurricane Center has been informed through the National Oceanographic and Atmospheric Administration that we will have a very active 2020 hurricane season. Just imagine, Mr. Williams, you have been at the forefront at times with us, having an active hurricane season in the midst of a pandemic. Now, they have projected 13 to 19 named storms with approximately 6 to 9 hurricanes and 3 to 6 major hurricanes. Now, Mr. Williams, remember, it only takes one tropical storm to challenge the Caribbean region and St. Kitts and Nevis by extension amidst the COVID-19 pandemic.
Right, so it is an above normal hurricane, you said, with 13 to 19 named storms. Now, of those 13 to 19 named storms, how many are expected to become major hurricanes?
Well, according to the forecast for now, and now, Mr. Williams, one of the things I want the general public to understand is that weather is dynamic by nature. And therefore, even though they predict 3 to 6 major hurricanes, that is category 4, 5, thereabout, you can actually have a degradation of that number, meaning that number can be lowered or actually can stay the same. We are hoping that this number can be reduced at a later forecast, but for now, it is expected that 3 to 6 major hurricanes will be impacting the Caribbean region.
Right, so that means that these hurricanes are what we would consider major, categories 3, 4, and 5.
Correct.
With wind speeds of up to 111 miles per hour, or even higher.
Higher, 138, which is category 4, and anything over 155 miles per hour, that's a category 5, like what we experienced in 2017. And I must say, Mr. Williams, in reading and following up with a number of the forecasts that are being projected. It is said that they are comparing the 2020 Atlantic hurricane season with the 2010 and the 2017. We can vividly remember Irma and Maria, and Vesta is in the studio and she went through the experience. And I can tell you, I wish for us not to be able to experience 2017 again.
Well, somehow we were, for the majority of it, spared from the full brunt of Irma and Maria in 2017. However, we can recall the devastation that was done in the Caribbean region, for example, like places like the Bahamas and so on, decimated in some areas, and the loss of life right. and the loss of property, flooding, and so on. So hurricanes bring with them tremendous force.
Correct.
In terms of wind and in terms of rainfall. And of course hurricanes are formed off the coast of Africa every year.
Yes.
And Mr. Samuel, what would be some of the conditions that would create this above normal hurricane season?
Well, according to the science that is being shared with the disaster management practitioners and also engaging with our chief meteorological officers, and they have stated to us that our waters, the surface water temperature is very high. And also they are seeing that there are low pressure systems that are basically right now traversing through the Atlantic basin, and that's the Hurricane Alley. And that Hurricane Alley is from the west of the African coast to the east of the Caribbean and up to the United States and also into the Gulf of Mexico. So, Mr. Williams, all these elements and the wind shear, the lack of wind shear as well, so all these elements combined make it an active hurricane season.
Right, and of course you said earlier that because of where we are in the world, we have this hurricane season every year from June 1st to November 30th. And while it is what it is, we have to prepare for the hurricane season. Now, what advice, Mr. Samuel, would you give in terms of preparation? So there's preparation, of course, and if there is a hurricane, then we have to think in terms of response and recovery. But let us start with preparation. How do we prepare for a hurricane season? And as you said, of course, the above normal hurricane season.
Thank you, Lester. I think it's a wonderful question, and this is what we need to engage the general public on, preparedness. But Lester, let me take it a step further. Let's speak about mitigation before we reach to preparedness. Mitigation is the aspect of putting the necessary structures and policies in place to be able to reduce the impact, because we know every year we are going to face a hurricane. So therefore, things like strengthening our building codes, looking at enhancing our drainage system, ensuring that they are clean, for example, ensuring that persons build their roof to the standards, having proper insurance for our properties and also our belongings such as vehicles. These are some of the things that we can do to mitigate. And the policies in particular is critical, and infrastructure. And that's why very important is social safety networks. For example, let's see that $500 poverty alleviation program. These are mitigative measures that help us to reduce the impact. Now, in doing that, then it leads us to the phase of preparedness, because we already have the necessary policies and infrastructures, and then now we have the ability to prepare. What do we need to do? For example, develop a plan. Let's take it to the family level, or the personal level, or the human level. Let's develop a plan. Develop a plan in the home. If this impacts us, what are we going to do? 1, know where your shelters are. 2, know the emergency numbers. 3, know exactly who are the volunteers for the various non-governmental organizations and also the district managers so that they can assist you if you need help. Also, Lester, what is critically important is for you to have a little go bag or a quick bag that you can pick up to go to the shelter with. These are some of the critical things that you have to sit down with your family. And I want to encourage and appeal to the general public. Take 10 minutes and sit down with your family and speak with them. If we reach a situation whereby we are displaced, where do we meet? Where do we go? Because, you know, it was disheartening listening to some of my colleagues who responded to the impact of Dorian in the Bahamas, whereby some parents lost their children because the children didn't know where to go. You would have heard stories of fathers holding on to their sons, and because of the rising tide that came inland, it would have inundated the entire homes, and the currents would have actually swept away their child from them. One particular father actually saw his son wash away from him as he attempted to hold him on the top of his roof. So develop a plan. That's the first thing you got to do. Sit down with your family, discuss with your family. If this happens, this is what we will have to do. Consult with your contractor, or if you have a friend who is a contractor, speak with him, ask him. What kind of window shutters do I need for my home? Do I just buy some boards and have them so I can board up? Or do I buy the fabricated one that can actually go and, you know, the window, and you have them there year round? And that is critically important to know. And Mr. Williams, very important to note, for example, it's good to have some cash on hand. We saw a situation whereby banking institutions and their accessories such as ATM machines would have basically have gone faulty during these times. It's also good to have some cash at home. We also go to the discussion of perishable items. It's very good to have during the hurricane season an extra cache of perishable items that you know exactly where to get some extra food in case you have to go to the shelter. And your medication. If you suffer from any underlying illnesses, diabetes, high blood pressure, or you have some heart condition, make sure you have some extra medication that you can walk with and you can go in your go bag in the event that we come under the threat of a tropical storm or impacted by a hurricane. These things are very important to have. You have to sit down on a family. As a family, you have, if you live by yourself, individually, establish how you need to conduct yourself in the event that you receive the information. And remember, Mr. Williams, there are several phases to this. You go from the alert phase to the watch to the warning. What does that mean? 72 hours prior to the feeling, basically, where you're going to experience hurricane-like conditions, you're going to receive an alert from the Met Office. And at this point in time, I wish to pause and acknowledge Mr. Elmo Burke, Senior Met Officer, who does a tremendous job every year to ensure that we receive adequate and timely information. And then, Mr. Williams, after you have the alert, then you go to the watch. That means that within 48 hours, you are likely to experience hurricane or tropical storm conditions. After that, the other phase will be what you call the warning. And once you know your warning, you know that you are likely within 24 hours to be impacted and experience tropical storm or hurricane-like conditions. So these are critical for the general public to know. And I also want to thank my communications team that every year they continue to educate the general public. However, Mr. Williams, I want to pause and admonish the general public as well that every year we continue, and we are still seeing small pockets within the population still not adhering, but yet as soon as they know that we are going to be impacted, that is when they start preparation. Let it not be too late. Start to prepare now. It's very important. And I also send that message to the business community and also our social partners, such as the churches, who have good programs that support our efforts when we need to respond.
Right. I know you mentioned a lot of things. I just wanted to add perhaps the insurance of property
Yes.
in times of disaster, and having things at hand like radio,
Yes.
and make sure that your cell phone has enough credit and so on. Those things are important in terms of communicating and to know what is happening. Now, the role of the National Emergency Management Agency, I think you need to expound a bit on that, because there are some people who feel that the NEMA only operates when it comes to hurricanes. So what is the role of the National Emergency Management Agency in times of hurricane or any other disaster?
Okay. Mr. Williams, traditionally, NEMA was a hurricane-centric type organization, or let me say agency. However, over time, we saw the various risks and threats that the Caribbean region was susceptible to. Then the Caribbean Disaster Emergency Management Agency, CDEMA, came up with a concept or policy to adopt what you call Comprehensive Disaster Management, CDM. This was adopted, I think, in 2002, thereabout, early in the 2000s. And we also adopted the policy as a member state of CDEMA. What that means? A comprehensive approach to disaster management, whether it be natural, man-made, technological, or otherwise. We are there to manage any type of national impact. What do I mean by national impact? Meaning anything that overwhelms the local capacity. So then we bring together all of government's assets, whether private or otherwise, to be able to respond and manage and coordinate the response effort to any type of catastrophe on St. Kitts, Nevis, and by extension, the region. And NEMA's job is to coordinate. We become the government headquarters of St. Kitts and Nevis during an emergency. And Vesta is challenging me because I have to watch into the camera all the time. So we become the government headquarters of St. Kitts and Nevis when it comes to disaster management. Now, there are 3 levels. We have the Secretariat, which is the agency that deals with the day-to-day operations. When we go into an operational mode where the NEOC is activated, then we go to the NEOC, which we experience. The NEOC, which is the National Emergency Operations Center, brings together again all of these assets, as you have been experiencing and exposed to during the pandemic response. Then you have the executive level of the NEOC, and that executive level comprises of senior government officials, to that of ministers, permanent secretaries, and the NDC as the secretary to that executive committee. Now, there are 2 critical areas that I must mention. You have the 10 national subcommittees. So those are the 10 committees that deal with the response, deals with recovery, mitigation. Now, who oversees all of this operation? The Mitigation Council. And that Mitigation Council is chaired by the Honorable Attorney General, who represents the Honorable Prime Minister, who is actually indicated by the national plan as the Mitigation Council Minister. However, the Honorable Prime Minister has the right to delegate that responsibility. And the Honorable Attorney General is the Mitigation Council Minister at present. And one of the things that I like, Mr. Williams, is that the pandemic has shown that the Mitigation Council Minister needs somebody to assist him. So Cabinet has taken a decision to appoint a co-chair to the Mitigation Council, and I am informed that the Honorable Wendy Phipps is the co-chair to the Mitigation Council Minister, and I want to commend her highly because Minister Phipps has actually burned the midnight oil every day to be there to support the actions and responses of the NEOC. So I want to commend the Cabinet for taking that active initiative.
Right. So, of course, preparing for the hurricane season this year comes with its challenges. In a region where we heavily rely on tourism for our income, the tourism industry has been seriously affected. And it is only then that you really see how fragile the tourism industry can actually be to disasters, hurricanes, health disasters, and so on. Here it is that we have a time of economic hardship. We have loss of jobs. We are talking about social distancing and so on. Preparing for this 2020 Atlantic hurricane season is not the normal type of preparation. Could you share with us, Mr. Samuel, some tips in terms of how we can best prepare during this time of the COVID-19 pandemic?
Great. Mr. Williams, and I am going to follow, thank you for the question, I'm going to follow what we have established here in St. Kitts and Nevis that has redounded to the successful response and recovery of the first wave during this COVID-19 pandemic. I am going to go to the COVID-19 emergency powers regulations. We have to look at the hygiene practices, protocols. We have to look at social distancing protocols and the physical distancing protocols and the wearing of masks. So therefore, Mr. Williams, if we are of the same household, we carry the same risk. What does that mean? That if we have to go to a public place, we can gather together as a family from the same household. However, if you're going to have to interact with other persons, we are encouraging you to develop your plan, as we are doing with the shelter managers and we are doing with the shelters in particular, is the 6 feet distancing, using also the 30 square feet per person equation. So therefore, in preparing for the hurricane season, look at if you have to go into a shelter, you know that one, you're going to have your mask. Two, you're going to have to exercise your hygiene protocols, washing your hands, ensuring that you have your hand sanitizers, ensuring that you do this before and after coming in contact with surfaces, ensuring that you sanitize the surfaces that you are going to use, ensuring that you keep just to your group, meaning your family, and if other persons, you exercise that cleaning process. Now, as it pertains to the social distancing, we cannot have the same gathering like before. We're going to have to ensure, Mr. Williams, that you go through that screening process of temperature check, the questionnaire to ensure that you have not been in contact with, and if you have been in contact with, we might have to place you in a different location than other persons who are not as high risk as you are. So these are some of the things that you have to take into consideration while we are preparing. The hygiene protocols, wearing of masks, the social distancing protocols, and the physical distancing protocols. It's very critical that you follow those 4 concepts in preparing for this hurricane season.
Right. While we are preparing, Mr. Samuel, for the hurricane season, we are also thinking the government is planning to, at some point, reopen its borders. And reopening its borders would mean, of course, that it's reopening to tourism activity. And as we know, some countries, especially those that we receive most tourists from, the United States and places like Europe, they are battling the pandemic much worse than we are here in the Caribbean, and in particular in St. Kitts and Nevis. Now, with the opening of the borders comes, of course, potential risks. comes hazards, health hazards, of course. How can this help in terms of creating a worst case scenario, especially if a hurricane hits?
And Mr. William, thank you for the million-dollar question that everyone has been asking me for the past month. We just completed a very successful meeting, the National COVID-19 Task Force, which is chaired by myself as the NDC and co-chaired by the Chief Medical Officer, Dr. Hazel Laws, along with a number of our members, met with the hoteliers at the Marriott's just yesterday. I could tell you the meeting was very fruitful, and it was actually convened by the Ministry of Tourism as the lead ministry responsible for tourism and the hotels. Within the meeting, we discussed the protocols for the reopening of hotels. We asked that as stakeholders within this preparedness for the reopening of hotels, we asked the hotels to come up with a number of protocols that their international partners are using. And while they are also considering that, the Marriott and the Park Hyatt have a lot of protocols that other small hotels in St. Kitts and Nevis can adopt. One of the things I reminded them of is the hurricane season is here, and within the ending of August to the beginning of September, we know that's the time when the hurricane season will peak. Dr. Laws asked them, because we spoke about that, opening the borders when they're reopening. And they gave a specific time period. And that time period coincides within the peak of the hurricane season. I believe the time period they gave is adequate, is good. It gives enough time for us to be able to put the necessary structures in place so that we can continue to enjoy the gains we have made, but most importantly, we must learn to coexist with this virus. Some persons don't like it when I say that, but we have to learn to coexist. Mr. Williams, as I shared with you earlier, Antigua already opened their borders, and we saw that a report came out today where they have had now 39 confirmed cases, and these cases were imported by persons who came in after the borders were opened. How do we manage a situation like that in the context as well of the hurricane impact? What I can say to you, what that will do, it can hamper or it can alter the time that we are looking at or suggested by the hoteliers for reopening the hotels and the borders. And that was well accepted and understood. However, we can continue to pray as a praying nation that the country can reopen the border within that time period that we are looking at. We are going to make that submission to the cabinet for the cabinet to consider, and once the cabinet considers, debates it, and approves the time period that is being recommended, then we will come to the general public and let the general public know this is the time period that we are looking at. But before we do so, we have to put structures in place, Mr. Williams, for one, a post-impact quick recovery that we can continue to have the economy moving, and also the likelihood that we will have imported cases when we open the border. That goes without saying. We cannot run away from it, and that is why we keep stressing of the measures that we have in place right now for persons to continue to adhere to them: social distancing, physical distancing, the hygiene protocols, and the wearing of masks. These structures, once they become a part of us, a norm within our society, then it will aid the structures that we will put at the borders to mitigate the importation of cases to St. Kitts and Nevis, because, Mr. Williams, respectfully, I don't believe that we're going to be able to go back to these hard lockdowns and freeze the economy, and then unfreeze the economy easily. We're going to have to coexist. And that's where we have the compliance teams that goes around to the business places and ensure that the business places are compliant. We are encouraging, for example, the hoteliers, and we are going to also encourage the border patrol agencies or the border agencies, those that manage our borders, to do things like go, use technology to assist us during these new border management measures during the COVID-19 pandemic. So these are a number of things that we are looking at and working at, and we are hopeful that the hurricane season does not impact that, because the impact of the hurricane season will basically slow all this process down. And again, we have to consider that our borders have to be open. And now let's look at this, Mr. Williams. If we are impacted with a hurricane during the pandemic and our borders are still closed, we may need humanitarian assistance. We're going to have to find ways to deal with those persons, because anybody entering our borders must be quarantined, must be tested, must be screened. So these are some of the things that we're going to have to look at. We might need to have our regional partners such as SIDIMA enter, St. Kitts and Nevis to enter. We have USAID and all these other international agencies that normally respond. How do they respond to an impacted state in the Caribbean within the context of still suffering from a pandemic? So all these things are being taken into consideration as we prepare for the hurricane, as we continue to prepare for the hurricane season.
Right, so we have to prepare, of course, for a safe and healthy reopening of our borders, while at the very same time preparing for any eventuality with respect to the hurricane season, which we alluded to is above normal.
And Mr. Williams, may I say, and I'm glad that you are emphasizing above normal, may I say, when we open our borders, that is the likelihood when the second wave will begin in St. Kitts and Nevis. We already have gotten over the first wave. We have gone 60+ days, and I want to, at this point in time, congratulate every single citizen, every single responder, every single individual that has worked collaboratively or otherwise to ensure, and by extension the government, to ensure that we are enjoying the freedoms that we have today, Mr. Williams. It's very important to acknowledge that, because we are now have to come together in solidarity to ensure that we prepare for this hurricane season. St. Kitts was spared, as you said, in 2017 we were not impacted. We were affected by the passage of 2 Category 5. And if we are impacted by a Category 5 this year, we are going to have to be our brothers' keepers, sisters' keepers, every kind of keeper we can be in order to survive such impact during this pandemic. It's very important.
And it's so important you mentioned that even though we were not directly impacted by the 2017 Atlantic hurricane season, Irma and Maria, there was still quite a number of persons who suffered damage to their property. A lot of people, of course, their roofs suffered damage. And the government's roof repair program was a very good program that assisted many people throughout the entire country to fix their roof. Of course, you can't think of a hurricane, another hurricane coming, and your roof is leaky, or you still have tarpaulins on your roof and so on. And of course, it's a time now where people can fix their roofs, because you fix your roof while the sun is shining. You don't fix your roof when it's raining, of course. But this year, Mr. Samuel, the 2020 Atlantic hurricane season was off to an early start.
Of course, yes.
Of course, the first one, of course, was a male by the name of Mr. Arthur.
Arthur. Correct.
Right? What are some of the other named storms that we will have during the 2020 Atlantic?
Okay, so, Mr. Williams, yes, every year the names come out, and what I am told that the names are not repeated. That is very important to note. The names are not repeated. I did some research to follow up. Mr. Elmer Bork informed me, he told me about it. I did some follow-up research on it, and I also visited the National Hurricane Center in Miami, and we discussed that, and they said, yes, the names are not repeated. So it's amazing how they come up with these names every year. So for the 2020, as you said, Arthur came out batting first. He was the opening batsman. And then we had Bertha, Cristobal, and Dolly, who is right now in the Northeast Atlantic and will be of no threat to land for now, according to the forecast. So we have 4 storms that already have gone out the gate. And so we have 15 more remaining. And the 15 remaining are Edward. That sounds more like a French name, Mr. Williams. You are very good with
Yes, and I know Cristobal is Spanish.
Is Spanish.
Means Christopher.
Christopher, correct.
So.
And then we have Faye, we have Gonzalo, Hannah, Isaias.
Isaiah.
Well,
in English.
Yes, sorry, so pardon my Spanish tongue. I had to pronounce it that way. Josephine, Kyle, Laura, Marco, Nana, Omar, Paulette, Rene, Sally, Teddy, Vicky. I have a sister named Vicky, lives in Tortolo. And then we have a Vicky right here in the room, in that of Miss Vesta Southwell. And lastly, Wilfred. Those are the named storms for the 2020 Atlantic hurricane season.
Right. So in actual fact, we have 21 of them here.
Yes, correct.
There are 21 here.
Yes.
Or they said 13 to 19.
13 to 19.
But
right.
but there are 21.
Correct.
So of course, they're only given names when they become storms.
Storms, correct.
But what basically is the process to get up to the storm? There's a whole process leading up to a hurricane.
Of course.
Could you outline that?
Okay. So it begins as a tropical depressions where a number of clouds get together, and the clouds are moving from the west coast of Africa, and they're moving across the Atlantic basin where they come into the warm waters. And once they come across and they move from a tropical depression, and then from tropical depression they moved, it comes together with the low pressure system, and then from there with the wind shear and everything else, the moisture, then it becomes into a tropical storm. And from a tropical storm, then it grows into a hurricane.
Yes.
Okay.
So it moves from a wave.
From a wave, tropical wave, like
to
we
depression.
See, to depression.
To storm.
Storm.
And to cyclone.
Cyclone.
Which is the hurricane.
The hurricane.
So it
correct.
goes through
a number of stages.
It goes through a number of stages.
For example, sometimes we have those that may pass us here in the Caribbean just as a depression. And by the time we reach the coast of the United States, it's actually a hurricane.
Right.
Right. So that's why I said the weather, hurricanes, or these storms are dynamic by nature. So we saw in Maria and Irma, where in less than 24 hours, they went up to category 5. So that is why when you are preparing, and this is critical, prepare for worst case scenario. So don't prepare for category 3, 4, prepare for category 5.
Because you never know.
You never know. You never know.
You never what is feeding the hurricane in terms of the warm waters.
Correct.
And so on. Just recently we would have seen, of course, a lot of Sahara dust.
Yes.
Which has come, which has been affecting the Caribbean and creating somewhat of a problem as well.
Correct.
For people in terms of their health
right.
and visibility.
Correct.
And so on. But Mr. Samuel, we are going to go to the phone lines and allow people the opportunity to ask their questions with respect to the hurricane preparedness, especially at a time when we are also managing the COVID-19 pandemic here in St. Kitts and Nevis. We are going to welcome your calls, and the numbers to call, the local numbers, 466-2666, 466-2666, 662-888, 8674, 662 8674, 767 4765, 767 4765, and 1239 645 4500. We welcome your calls. Right. So we continue with our discussion.
Sure.
In terms of hurricane shelters, they become a critical part in terms of if people have to go to a hurricane shelter. I know that you mentioned the whole aspect of all the COVID-19 protocols that should be kept in place, but it depends on the space.
Correct.
That is in these community centers. Do you think that we have adequate space in community centers to ensure social distancing protocol?
Okay.
Yes, working for you. Good afternoon.
Good afternoon.
Yes, good afternoon. We are hearing you.
Am I on the program?
You are on the program.
All right. I would like to remind Mr. Samuel that senior citizens sometimes have no way of getting to know what the news about the hurricane. Is it possible that maybe they could go around the area to a loudspeaker?
Thank you very much for your question.
Okay, thank you.
Okay.
Okay, Mr. Samuel.
Okay.
There is another call.
Okay.
Working for you. Good afternoon. Good afternoon. Working for you. We seem to have lost that caller. Mr. Samuel, you had somebody calling, of course, and asking about, people who are in vulnerable situations. And of course, during a hurricane season, you have to think about a vulnerable population, a vulnerable person.
Yes. And I want to thank the caller for that question, that comment. We do have something in place to deal with the persons who are vulnerable or within that vulnerable group as we categorize them. We have the social and community development, and that committee, which is headed by the Permanent Secretary of Gender Affairs and Community and Social Development, Janet Lewis. They actually have a database of all the vulnerable persons within the various communities. And that is also complemented by our district volunteers who do walk through the districts, and they identify these vulnerable groups, which the elderly falls in that group, and they carry little leaflets to them and give them tips about the hurricane season and so on. And I take that caller suggestion that she would like us to also add to that cadre of things that we do by going around with a loudspeaker and sharing information besides all the other means that we use. So again, to you, caller, your suggestion is noted, and I will pass it on to my public relations officer, who is responsible for communication. And she's actually right here, and she's taking note as we speak.
Okay. Now, vulnerable populations in a disaster.
Sorry, Mr. Williams.
Working for you, good afternoon. Good afternoon.
Yes, good afternoon. Mr. Williams?
Working for you, yes. How are you doing?
I'm good, man. Glad to have you back. And Mr. Samuel?
Thank
Yes,
you.
sir. Good afternoon, sir. Yes, sir. Thank you.
Yeah, you all are too great, man. You all have been doing good work over the months.
Thank
Yes,
you.
thank you, sir.
With the corona.
Yes.
Now, two questions. Now, we have some people here, they come from Haiti,
Yes.
and they open the gate our border gate before the gate supposed to be open legally.
Yes.
Now they all will have to be quarantined and looked after on a humanitarian level. Now, who gonna pay for their repatriation back to Haiti? And if the government has to pay for their passage back to Haiti, how would the government reimburse after that is done? And then the last thing, now hurricanes are destructive act of God, I should say. And they have nothing good about them to do to people. How come they're finding all kind of human name to give the hurricane? And they're not giving them names like wicked people, or like Adolf Hitler, and names like Satan. And those two names are destructive weapons in this world. How come? I listen for your response. And that's why.
Yes, sir.
I like the other day when you was in the thing and you said, well, and there were two kind of spirit. Yeah, the Holy Spirit and another spirit.
Okay, sir.
Thanks for your humor.
Right.
Okay.
Thank you. Right.
All right. Thank you, caller, for your for your question and also your comments. As it regards to the Haitians, the illegal immigrants that would have entered our borders while our borders are closed, I am informed by the Chief Immigration Officer that at present they are presently housed in a particular center where they are being managed. When I say managed, meaning they are being processed. I guess they will be interrogated to find out information. And also, as it regards to the COVID-19, I know CMO, Dr. Laws, and I spoke about the matter when it occurred. And I think by now, all who have been caught have been tested. We are I'm not sure, can I tell you, because there's so many moving pieces at the moment, whether the results have been received or not. But as soon as the results have been received, I'm certain that the country will be updated. This is one of the challenges that we addressed early on in our preparedness measures. Our borders, as you know, were being patrolled heavily by the Coast Guard, and I must commend them for the work that they have been doing. However, as any other Caribbean region or any other country, we are supported by other members, such as the French and the Dutch and the English, meaning the British, who have ships out there patrolling. But you know, these things will happen. And that's why we made an appeal to the general public to be the eyes and ears of the Coast Guard if they see anything. And whoever were able to provide that information, again, we commend you for doing your civic duty as a responsible citizen, which led to the police conducting their raid and ensuring that we controlled this situation. We are hoping that there have been no adverse effect in terms of any importation of positive COVID cases on St. Kitts and Nevis by this act by the illegal immigrants. As it regards to the cost and so on, I cannot speak to that. I don't know what the cabinet decisions will be. I'm certain at an adequate time, the cabinet will address the general public as it regards to that situation. So I ask the general public to be patient and trust the system and understand we are doing everything in our powers collectively, whether the police, the defense force, and also the other agencies such as customs. They are doing everything possible to manage the situation and ensure that St. Kitts Nevis remains COVID-free. Thank you.
Right. Now, Mr. Samuel, we live on an island, and hurricanes, of course, affect islands. And the way that we have always built, tourists like to come out of the hotels and walk right onto the beach. A lot of people live along the coast. What advice would you give during a hurricane for people that live close to the coast, coastal villages?
To be quite frank and straightforward, move away from the coast. That's the only answer. One of the things that we encourage, Mr. Williams, because of the impact of high surfs or wave actions, we ask persons to go above sea level, meaning go to higher grounds where the sea will not impact. Because remember that you can have the sea level rising, and also because of the wind that is associated, you can have high surf that will impact the coastline. And these can be very deadly and destructive. And we have seen where waves can impact in terms that they push, and when they push, they also pull. They can pull you into the deep waters. So we ask persons basically to go above the sea level or to higher grounds where the impact of the sea will not cause any destruction to them. Mm-hmm. And also, Mr. Williams, what is critically important is that to note is that persons should take precaution in build where they build. That is a very sensitive matter that has been discussed at varying levels. And what you find happening is that persons say, listen, I love to be by the beach, while other persons want to be away from the beach. I think one time investor told me she wants to build her house close to the beach because she loves the beach. But it's a sensitive matter that you will have to take an individual decision about that particular hazard of building near the coastline. So that's my answer to it. For me, Mr. Williams, I think that persons should exercise caution in where they build, where they know they will be adversely impacted. Yeah.
Right.
Yeah.
I would like to repeat the numbers to call. They're 466-2666, 466-2666, 662-8674, 662-8674, 767-4765, and our international number is 1-239-645-4500. Right. Now, in terms of one of the most crucial things in disaster management is that of being prepared.
Yes. Yes.
Hmm?
Yes.
Is that of being prepared. But to mitigate, you mentioned before.
Of course.
To mitigate, of course, the whole idea is to disaster mitigation.
Of course.
And that comes with the preparation.
Of course.
So that when the disaster strikes, that, you know, the impact is not as great because of the preparation that was put in.
Correct.
Now, in this case, we already have. Working for you, good afternoon. Working for you. Working for you, good afternoon.
Hi, good afternoon. How are you?
Yes, thank you for calling.
Yes, okay. I don't know if this question was addressed already, but concerning the Haitians that came into our borders, I understand that they were housed by some locals before they were caught. Are these locals also in quarantine or being tested just in case the Haitians have COVID and we don't know about it?
Right.
Okay.
So.
Right, Carlo, thank you for your call and your question. And let me say to you that the system is very comprehensive, whereby while the testing is going to be done on the Haitians, immigrants, also contact tracing will be done to know who they have come in contact with. And once this contact tracing will be done, then it will be followed up by testing to ensure that every person that would have come in contact with, they are negative, meaning that they have not been affected by the virus. Yes.
Right. Working for you, good afternoon.
Good afternoon.
Yes.
My question this afternoon is, as we are reconsidering to open the borders, suppose when the borders are open, we come up with 1 or 2 cases of the coronavirus positive. What would we be looking at? Would we be looking at going back into a state of emergency, or how would we be dealing with it? I will lift this off here, please.
Mr. Samuel.
Mr. Williams, again, caller, thank you for the call, and a very good call. And as I mentioned earlier, I emphatically emphasized and stated that we must learn to coexist with the virus. And I said it earlier. We have learned how to manage. We manage 15 cases. And what we are saying is that we want to put a robust system in place that if and when we open our borders, we are able to coexist with the virus, meaning that we can have our economy moving, we can have our society moving, while we have the structures and management procedures and processes in place to be able to contain the virus while protecting our citizens as they move along with their lives and livelihoods.
Yes. Mr. Samuel, I think that was an extremely important question, because the question implies, and of course in it,
Yes.
that it is not business as usual.
Correct.
And it is what we have been discussing in terms of how do you deal with a hurricane if it hits during a pandemic. One, a hurricane under a state of emergency.
Correct.
Now, if we have an increase in a number of cases of COVID-19
Yes.
because of the reopening of our borders. Earlier you said that Antigua now has 39 cases. What do we do? Because you're dealing with a hurricane, but then you're dealing with the fear factor.
Okay.
There is a fear factor.
Correct.
That is there. We can't eradicate that.
Of course.
That people are afraid.
Right.
And while it is true that we have to manage in terms of the safety and health of our citizens and that of still managing the economy, I think that a lot of people are still afraid that of, becoming contagious with the COVID-19. Okay. Now, if we have an increase in cases, let's say our borders are opened,
yes.
and then we hear that, look, we have 100 cases of coronavirus here for a very small population, then people start to become very afraid.
Right.
And so therefore, what do we do? Do we revert to some of the things that we had in place, for example, putting in a curfew and all of that sort of a thing? And then the management of a hurricane becomes even more difficult because, one, you were going to be talking about stay-at-home order or shelter in place. And then what happens if a hurricane hits? And then people cannot stay at home. They have to go to a shelter, for example. Yes. And then we are talking here again about social distancing and so on, because we don't want the spread of the virus. Yes. So it is not as easy as we are speaking.
Of course not. Of course not, Mr. Williams. And this is where, again, we're going to have to show that solidarity in terms of having an all-of-society approach to this situation. For example, Mr., as you just rightfully said, and I'm happy you highlighted it, shelters. Our shelters capacity, due to the preparedness for the COVID-19, has been reduced significantly. What does that mean? We have to now advise government on identifying more facilities for shelter. That's one of the things. Two, we already went through the management, Mr. Williams, of 15 cases. You saw that those cases, they were identified, contact tracing, then they were isolated once they were quarantined. Once they were quarantined, they were isolated when they were confirmed, and managed, meaning they were dealt with so until recovery. That is the same procedure that we will have to apply to these cases. Now, we're going to have to establish a threshold. As you said, if we get 150, 200 cases, is that overwhelming our health system? So once our health system has been overwhelmed, Mr. Williams, then we know, hey, this is the threshold for us here in St. Kitts and Nevis. This is the capacity. Whether it be 50, 75, 100, once we reach that threshold, it means then we have to apply a number of measures in order to control the system. And that is what the task force, along with a number of stakeholders, will be working on between now and that time period that we are looking at to open the borders. Because it's critically important. If a hurricane hits and you have 2,000 households impacted, let's say there are 4 persons per household in these 2,000 households. You're looking at 8,000 persons. Within those 8,000 persons, you don't know who may be carriers of the COVID-19 virus. So therefore, we have to now manage all of that by, again, putting the 4 things in place: social distancing, physical distancing protocols, hygiene, using the mask, doing the proper screening, temperature checks, and doing what we did before. Again, contact tracing, identifying, testing, and knowing that these persons are confirmed cases, and then you isolate and deal with that grouping. We're also going to have to find facilities to isolate these persons, quarantine these persons. Do we go back to quarantining persons at their home? And we saw the challenge that we have. Are we going to have more civic-minded citizens to ensure that they are well-behaved and cultured, knowing what we are facing? Or do we have to put them in facilities like we had to do with the OTI facility for us to put them there, to have them in a controlled setting? So these are some of the things that the task force is working on right now, along with the Ministry of Health and other partners, to ensure that we build a robust system. But furthermore, let me say, Mr. Williams, that is why I have said, and I will continue to say, I want to be the first to be last and the last to be first. We have seen what is happening in Antigua. We also are learning of what is happening in Jamaica. Look at the Honorable Prime Minister Keith Rowley in Trinidad and Tobago, where he said, listen, our borders will remain closed. That's the standard they took. Look at Barbados. Barbados is going to be opening, St. Lucia, Grenada. So, St. Kitts and Nevis, we are looking at all these members of the CARICOM and OECS who are opening. We are learning from what is happening to them. And from that, we are able to extract what we need in order to put in a very robust system here in St. Kitts. Again, Mr. Williams, we're going to have to learn to coexist. Look at South Korea. South Korea never closed down. Look at Taiwan. Taiwan never closed down. So we have to look at all these systems where we're going to have to use technology as well to assist us to live within this pandemic, and also assist us with dealing with the hurricane impact. If we are impacted, what we are looking at, putting persons in shelters, the management of, God forbid, bodies, if persons have to die, the management of persons that are going to be injured from such a destructive impact, and also persons who are going to be just generally displaced. So we have to look at all those concepts and put them into context in terms of a pandemic, where you have to put in those 4 critical things that I spoke to you about: the contagion that we are dealing with, and the destructions around us of our infrastructure. And also critically, our health system. How strong is our health system to address all this? Because, you know, it means that you have to deal with persons with broken bones, maybe lacerations. You got to deal with persons that, you know, may just be psychologically out of it. Okay? So that is why we have to address all that socio-economic impact of these national catastrophes. Yes?
Mr. Samuel, I know it is going to be quite a challenge.
Yes, sir.
But yet with the proper planning, you know, it is important. Otherwise, it would be a double whammy.
Of course.
It would be a recipe for disaster.
Yes.
If we didn't properly plan from the threat of the hurricane combined with the COVID-19.
Yes.
If there's no proper plan, it is a recipe for disaster.
And
I am particularly concerned because I hear us talking about social distancing.
Yes.
That seems to be one of the hardest things for people to do in the society. And we have seen people at the strip. There is no social distancing. We have seen some motorcades and things like that where social distancing was not practiced. And in terms of the shelters, social distancing, as much as you're saying it, will pose a problem. It is where people huddle together during a disaster. It will pose a social distance problem. Not only that, it will be coupled with those psychosocial problems.
Yes.
Fear and anxiety and all of that sort of a thing, and especially for older people and people whose system is compromised. Where will they go? We have a call.
caller?
Working for you, good afternoon. We seem to have lost that caller. Mr. Samuel.
Yes, Mr. Williams, you have highlighted a very critical thing. What we did in the early stages, in particular in my early discussions with Dr. Laws, one of the groups that we saw that was impacted severely, I have to use the word severely, because our society is not accustomed to that, was the elderly. And what we did, we took a triangulated approach to reopening. And do I pause?
You pause. We do have a call. Working for you, good afternoon.
Yes, that's right.
Good afternoon.
Hello. Hello.
Yes,
Good
hello.
afternoon,
Good afternoon.
Yeah, that's right.
Hi, Jam Down. How are you?
And Mr. Samuel.
Yes, Jam Dong.
This is a product of Jam Down, you know. The young man there, Mr. Samuel.
Yes.
That's right.
Yes,
That's right.
yes, Jam
Mr.
Down.
Samuel.
Yes, Jam
We
Down.
got some ignorant people around here. Still moving around without masks
Yes.
and doing social distancing. And that is a big problem, eh?
Yes.
That is a very big problem. And next thing I want to ask you, Mr. Samuel, how active the Coast Guard is and the East Coast. It looks like we got to put the army in 5 and 10 round there, go right up to the Southeast Peninsula, you know. Because what we're looking at, you know, is that these Haitians and other migrants going to come and take over. And we got to be careful. We have to be careful. We have a lot in here already. And, man, they're going to leave us and coming through. And you all got to look at that very seriously. I was trying to get into the Prime Minister last night, you know, because he come to me like the Chief of Police playing with these things. When you hold people, let's right, who accommodating illegal immigrants in the country to bring disease, you got to deal with it.
Okay. Yes. Right, Jam Down. So thank you very much.
Mr. Samuel,
Yes,
have a
sir.
good day.
Yes,
Thank
you
you
too,
very
Jam
much.
Down.
You
Thanks
too.
for the call. Well, what I want to say to Jam Down is that I know that the Coast Guard has been working tirelessly for months upon months. I can recall earlier when we started the closure of our borders, the Coast Guard made a number of interceptions of boats coming from Guadeloupe, boats coming from St. Martin, because St. Kitts, quote unquote, was deemed as a safe haven, and persons wanted to come here to quarantine or put their boats on dry dock or whatever the case may be. And the Coast Guard did protect our borders, and I must commend the brave men and women of the Coast Guard. And again, we rely on a number of our partners in the region and internationally who help us to manage our borders, and I think they are doing a tremendous job. You know, they may not be able to capture everything, but they are doing a good job, and let's continue to support them.
Right. Now, thank you very much, Mr. Samuel. I think that was our last caller for today, and we have to be wrapping up this program. Is there anything that you would like to share with the public before we go?
I want to give the general public the assurance that the National Emergency Management Agency and also the National COVID-19 Task Force, in collaboration with the Ministry of Health and other stakeholders such as the Chamber of Industry and Commerce, the Evangelical Association, Christian councils, and other social partners, continue to do their best to prepare our infrastructures, prepare all these groups and ourselves to be able to respond to the need of the general public within our limits to support response if impacted by a hurricane. However, I want to admonish the general public in particular to do their best, to do their self-preparation, do their self-assessment, and adhere to the regulations that are in place. Everyone is asking about opening the borders. Opening the borders have to come with a structure, and that is what we are trying to put in place at the moment, so that when we do so responsibly, we do so with a system that is workable, it's practical, and will keep you safe and secure. Mm-hmm. You must play your part as a citizen. You must play your part as a citizen to adhere to the structures that are in place, because those are the same very structures that are going to save us in the future. Wearing your mask to prevent the spreading. Also, adhering to the physical distancing, social distancing, and the hygiene protocols. I cannot speak anymore or emphasize anymore on those critical things. Continue to boost your immune system. Take your vitamins, eat healthy, exercise, sleep well. It's just yesterday I was telling Dr. Laws, I didn't sleep the best last night, but I've been sleeping good for the past few days after I started to exercise more. I started to take my vitamins a little more often. And these little things help for what is coming. We have to prepare for a second wave. And we still have to prepare for an active, as Mr. Williams has been emphasizing, above average hurricane season. The NEMA, the government, cannot do it alone. We need the assistance of the general public to be successful during this pandemic, as we have been, and we need the successes to continue by you being responsible citizens. With that said, I feel confident that if we are impacted, you will support the efforts of the National Emergency Management Agency and the government, by extension, to maintain St. Kitts and Nevis as a safe haven for our citizens, residents, and visitors alike. Thank you.
Mr. Samuel, I do want to thank you for coming today and sharing with us on such an important topic, that of preparing for the hurricane season, the 2020 Atlantic hurricane season. But it is an unusual time, an unprecedented time that we have seen in the last, perhaps nothing like this in the last century. Of course, with the COVID-19 pandemic still very much alive and kicking all over the world and in the Caribbean. I was reading that Latin America has now become the epicenter of the COVID-19 pandemic. They're just in our backyard. They are our neighbors, the Dominican Republic, and so on. The case is rising there. And we have to prepare, yes, for the hurricane, but we have to prepare with bearing in mind the safety and health of all of us, all of our citizens and residents. And so therefore, just like you said, we have to make sure that we adhere to all the safety and health protocols that have been put in place to prevent the spread of the coronavirus. So thank you very much again. I want to thank all of you who joined us today for Working for You. We're very happy to be back with our Working for You program. We thank all of our listeners all of you who have been looking on TV, those of you who have joined us on social media. We appreciate your company. Next week, we will be back with another edition of Working for You. Until then, continue to prepare, continue to stay safe, and to follow all the health and safety protocols that have been put in place for your own good. Until then, I am Les Roy Williams. Take care.
Working for You.